Induction of labour is a process that is used to start your labour, and it can be recommended for a variety of indications, and it can require a couple of different methods. The most common indication for induction in labour is post-dates or post-term or overdue pregnancy. We usually consider a term pregnancy being between about 37 and 42 weeks, and post-dates pregnancy is usually an induction of labour recommended anytime from 41 weeks. In Australia, about 10% of women go overdue or post-dates in their pregnancy. There are a number of different methods we use for an induction of labour, and these depend on your clinical circumstances and also on an internal examination of the cervix, which is the neck of the womb, to see what the cervix needs to help facilitate labour. And that may be medication or a mechanical device called a balloon to help to dilate the cervix, or it may require breaking of the waters or rupturing the membranes around baby and starting a hormone medication through a drip. All of these processes are used to start labour and may be dialed back or altered throughout the course of your labour, depending on how your body responds.
Sometimes there are things that change during your pregnancy, which don't necessarily present a huge emergency risk, but they might suggest that it would be safer to bring on your labour at a certain point in pregnancy instead of waiting for labour to naturally start.
Women may choose, even if everything is normal, to have an induction of labour, and this is something that you need to discuss with your caregivers based on your individual circumstances.
I've had every type of induction. 5 babies, 4 of them were born via induction. The first one I hadn't self-educated myself. I probably didn't ask enough questions. I'd been to my regular appointments, but there was a lot of unknown. Asking questions, I think, is really important. There's no such thing as a silly question throughout your appointments. For my 2nd to 5th baby, I always had a pen and paper handy in the kitchen. So when I thought of something, I've got an appointment in 2 weeks, I'm going to write that down.
When change needs to occur, it follows the same pathway that a midwife would have in any labour. It's talking through decision-making, benefits and risks. There are a lot of situations where they need to be pre-informed so that they can quickly make decisions going through their birth journey.
Risks and benefits for induction all depend on the indication for the induction, the method of induction that we use, and your individual clinical circumstances. It's best that you talk about these specific risks and benefits with your midwife, doctor and treating team.
Just knowing that with an induction, it's planned. I don't think there's any such thing as a 100% birth plan and sticking to it ever. I really just enjoyed, okay, so this is what I'm doing. Let's just take a moment to pause and think about getting into that mindset of getting to meet the baby.
Other considerations for induction of labour include preeclampsia or high blood pressure problems in pregnancy, any problems of growth for baby, and this may be overgrowth or undergrowth, and other things we measure for are baby's well-being, and that's things like looking at the level of fluid around baby or the blood flow measures on ultrasound. Other conditions that women may have heard of or have experienced, including itch in pregnancy, something we call cholestasis, is when itch may affect baby's well-being. This also can be an indication for an induction.
A woman needs to prepare for induction of labour the same way that she would if she was going into spontaneous labour. You do have a little bit more of an insight as to timing. You just need to bring the same things that you would normally bring that make your environment feel safe, more homely, and how you would like things.
I probably thought, how's my body and the baby going to react to the Syntocin drip? It's a drip that releases oxytocin, which is the labour hormone, so it helps your contractions get started, and then the midwife can make it stronger the longer that your labour is going.
With that artificial hormone that's released through your body, it can bring your contractions on a lot faster and a lot more intense as well. So there is a need to have had a previous discussion with your midwife about induction of labour that also covers the plan that you have for pain management as well. As midwives, we like to have that conversation pre-birth just to make sure that you have got a really good understanding of what your analgesia options are, and making sure that you understand the risks and benefit for each of those pain management options as well.
An induction of labour can be a time of worry for women. They're worried about themselves, they're worried about their babies, and that's because this matters. It's not common that things go wrong, but some things that women may worry about are whether they may need a caesarean birth, whether they may need an instrumental birth, or any other sort of intervention throughout their labour that comes with an induction process.
Throughout the day, the midwife becomes your best friend, really. I mean, your partner or your birthing person is there, which is great, but just having that open communication with the midwife and just trying to take every moment as it comes, really.
For some women, the recommendation of an induction of labour may be quite unexpected and not what they were planning for their birth. It's important to remember that the team caring for you are only recommending an induction of labour when the risks to remaining pregnant outweigh the risks of an induction. The team caring for you are coming to work hoping for a good outcome for you and your baby. So when induction is recommended, that is the time that you can use to voice your concerns and come up with a birth plan for induction that works for both you and your baby.
The most important part of the induction of labour is that you are feeling comfortable, that you understand the process, that you've had opportunities to ask questions and really make informed choices.